Okay. Good afternoon, everyone. Welcome. Happy Wednesday. I think we'll go ahead and get started because I know everyone has a busy schedule. My name is Nancy Savage, and I work for the Human Development Institute at HDI at UK. And I've worked for UK for about 8 years, but honestly, I'm a little new to HDI, so I'm getting to know this wonderful department. Being a part of this series that we've had for the last several months has really given me an opportunity to expand my knowledge base. So I am learning along with the rest of you, and I appreciate the opportunity. So before we get started, I did want to mention that we are recording this session, and as soon as the recording is available, I'll go ahead and share that link with everybody. And we also encourage everyone to ask questions throughout. You can either do that verbally, or if you prefer to do it in the chat box, I'll be keeping an eye on the chat box as well. So like I said, everybody has a very busy schedule. This is only a 30-minute session, so why don't we just go ahead and jump right into it. Higher education, it plays a pivotal role in employment outcomes. And as you all know, UK Healthcare has just launched Project Search, and that is an amazing program that connects higher education and healthcare and helps to transition students with disabilities. So this is a very timely topic, which is today's topic is strategies for career success for students with disabilities. And I have the honor to present our speaker, Johnny Collette. He is the Deputy Director at the Human Development Institute. And welcome, Johnny. And if you don't mind, hello, welcome. If you don't mind, would you share a little bit of your background with everyone before we get started?
Sure. Well, I'm first of all happy to be here. I'm just becoming such a fan of the Project Search work, and I know we're a part of that, and get to the honor of being a partner with UK Healthcare, Fayette County Schools, and the Office of Oak Rehab. But I find myself talking about Project Search a lot now when I'm out in talking with other groups. So I've done that over the last few weeks, and just really love learning more about what we're doing here and how we're leading, and then sharing that and how it connects to so many other efforts that are underway in our state that I think folks like us have to make those connections, right? I mean, it's not necessarily the default position where everybody's just going to automatically say, oh, that connects to this. No, that's probably our job, and I'm glad we do it, and we do it so well. But thanks for letting me be a part of telling the story as this story is unfolding at UK, and specifically at UK Healthcare. So, I mean, disability employment education policy has been my entire career. I started in the high school. I started as a classroom teacher at the high school, and I taught in Scott County here in Central Kentucky my whole teaching career. And I was a special education teacher and taught in the content areas of biology and chemistry, which is interesting given my own grades in biology and chemistry from my own high school career that we can talk about some other time. But that's where I started really thinking about. So I've been thinking about the transition of students with disabilities through and after high school for my entire career. And that has included certainly academic achievement, but also employment outcomes. And so I got to be in the classroom for a number of years, and then I went to the Kentucky Department of Education and had several roles there. I started as a transition consultant, so thinking again about transition from school to whatever comes next in the lives of people with disabilities. And before I left the Department of Education in Kentucky, I was the state special education director. So I got to work with all, at that time, 175 school districts. Now we have 171 school districts because of some mergers and other things, but got to work with all of those districts around their implementation of the Individuals with Disabilities Education Act in their local educational agency. And again, thinking about how we move, if you will, from just, if I could call it, mere compliance to how do we really leverage the requirements around special education and think about improving outcomes. So was at the Department of Education in Kentucky for until early 2015. And then I transitioned to a national nonpartisan nonprofit in DC called the Council of Chief State School Officers. So what that group does in DC is they work with all state education heads. So in Kentucky, we call that a commissioner. Some states call that a secretary of education. Some call it, something else, but we just refer to it as the state chief. So whoever was in charge of education in their states. And I got to work for that organization at the national level, again, a nonpartisan nonprofit in DC. And again, thinking about how we help state education heads and all of their teams to improve outcomes for people with disabilities. And I was the first person to get to serve in that role. It was a brand new position at this very well-respected national organization. And I was happy to serve in that role for a number of years, and then moved to the United States Department of Education when I was nominated to be Assistant United States Education Secretary in the Office of Special Education and Rehabilitative Services at the U.S. Department of Education. I was confirmed by the Senate on their way out of town for Christmas in December 2017, and started serving at the U.S. Department of Education in early 2018. Was proud to serve in that capacity for a couple of years, and then come back home to Kentucky at the end of 2019, and find my way here to UK. So I just really feel like I've been fortunate to have what I kind of refer to as a 360 view of this work over many years. And I think I've learned a lot. I've still got a lot to learn, but I hope that we can share some things today that resonate with you, that are helpful to you. If not, that'll all be my fault and nobody else's. And tell us where we hit the mark, tell us where we missed it, and we'll get better next time. But that's it, Nancy. That's enough about me.
Okay. Well, thank you. So I guess the first question would be, what does the data tell us about post-secondary education and employment for people with disabilities?
Yeah, and I hope this can be a really dynamic thing. So I'd love for this to be a discussion, right? If anything I say sort of prompts a question for any of you who have joined today, or you have a question about something I've said, let's just talk about it. And I have no expectations of anything specific or special for me. I'm just here to meet your goals. So let's get started, see how it goes. And if it's not meeting your needs, we'll make adjustments along the way. But I do think the data are important to look at, right? At least, we can't improve what we don't understand. Right. I mean, that's just as we probably all know, and certainly we've learned much of what we know about systems improvement from the medical field and folks and professionals like all of you for so long who have led in systems change and systems improvement from that medical side. And we've learned a lot of that on the sort of education and employment side of things. But at any rate, one of the key things we know about systems improvement is you can't improve what you don't understand. So we've got to see the system as it is to get to a system that we envision together and that we aspire to. So when we back way out of that and think about data, you may or may not know, in Kentucky, there are about 105,000 students with disabilities in Kentucky. So over 100,000 students with disabilities in Kentucky. And that means that students with disabilities account for roughly 15 to 16% of the population of students in Kentucky. So we're not talking about an insignificant number of students here, and clearly a fairly significant number. I mean, one of the questions is always sort of how's that stack up, with other things nationally. I mean, nationally, the number's probably between 14 and 15% of the general population. But, over 100,000 students with disabilities in Kentucky. And, if you look at there are 14 disability categories in Kentucky. And of those, there are four of them that make up around 50% of students with disabilities at the school age. So that's specific learning disability accounts for around 17% of students who have individual education programs under the Individuals with Disabilities Education Act. So specific learning disabilities in something like reading or math, accounts for about 17% of those students with disabilities. Those who are identified under the category of other health impairment, which is a very broad category, could include things like ADHD and other diagnoses. That accounts for about 15% of students with disabilities in Kentucky. Mild mental disability, and in Kentucky we have intellectual disability, which is the category sort of in the federal law. We have that broken down into two categories in Kentucky regulations, and one of those is referred to as mild mental disability. The other is functional mental disability. But mild mental disability accounts for about 10% of students with disabilities in Kentucky, and autism somewhere around 9%. So, I do think those data are helpful in terms of recognizing that we have, again, a pretty large group of students in Kentucky that are identified as having a disability, and about 50% of them in those several categories that I just mentioned. But let's think about some other numbers. So let's back even further out of it. And I'm probably saying a lot of things that you're like, okay, I know that stuff. Well, okay, fair enough. That's where you're going to help us know we didn't hit the mark, and we'll get better next time. But people with disabilities overall, if we look, there's about 1 in 4 Americans have a disability, 1 in 4. So how's that look in Kentucky? Well, there are even more, right? About 1 in 3 adults in Kentucky are identified as having a disability. So somewhere in the neighborhood of about 37% of Kentuckians identify as having a disability. So we're talking around 1.3-ish million Kentuckians, and that's adults with disabilities in Kentucky. So we have among the highest number and proportion, if you will, of people with disabilities in Kentucky compared to the nation, among the highest proportion, but also at the same time among the lowest percentage of those individuals with disabilities who are employed. So there's a 42% gap between people with and without disabilities when we think about employment, and that ranks Kentucky 48th in the nation. Not a designation we appreciate or want to keep, right? We don't want to win there, but we're 48th in the nation, and it also means we're behind all 7 of our neighboring states. So if you're a proud Kentuckian, as I know you probably are like me, and proud member of the flagship and how we advance Kentucky here, we get our competitive juices rolling a little bit and saying, how do we contribute to advancing Kentucky's workforce and economic advancement, and how do we more intentionally include what is clearly a pretty significantly underrepresented population in the workforce. So those are some workforce numbers. Real quick, let me switch, and I'm going to pause, but let me switch to some higher education numbers. We think about just youth and young adults with disabilities for a minute. So we kind of know what a lot of these students are doing because of some federal requirements on reporting. We know what a lot of these students are doing a year after they exit high school. So if students had an individual education program or an IEP in a Kentucky public high school, then we track that a year out. Where are those students? Kind of what are they doing? We have to report on that at the federal level. It doesn't mean we get to every student, but we do have processes and protocols in place where we do that here at the University of Kentucky Human Development Institute. We do that work for the Kentucky Department of Education, and then they report it to the U.S. Department of Education. So if we think about students 1 year out, so 1 year after they leave high school, only about 40% of those students are competitively employed in the year following their exit from high school. Well, you're thinking, well, maybe they're enrolled in post-secondary education. I wish that were true, more true than it is. Less than 20% of youth and young adults with disabilities are enrolled in a college or university in the year following their exit from high school. Actually, when I say less than 20%, I looked at some numbers this morning, it's probably more like 14%. So it's quite a bit less than 20%. So even using those numbers, though, in the year following exit from high school, 6 out of 10 students with disabilities are not competitively employed. 8 out of 10 are not enrolled in a college or university in that year following exit from high school. So, again, we've clearly got, not an insignificant number of individuals we're talking about here. underrepresented in both the workforce and in higher education. So we can pause, Nancy. I mean, you wanted me to give you some kind of big, broad data. I think that may be a good start, but that may have generated some questions or feedback from the team. Or may not. So it's up to the team to decide.
Well, I have a question, I guess. If you are a parent of a child with a disability, what can you do? What's the earliest, what should you start looking at? What would you be some guidance on how you can help your child transition to a post-secondary education opportunity?
Yeah. So, I mean, I think we all know around any sort of intervention, typically earlier, the better, right? So the earlier we can start talking about, aspirations for those kinds of opportunities, the better, right? So, I don't know that it's ever too late to try to do what you think is the right thing, but you can certainly set yourself up and create an environment that increases that potential, I think, if we start earlier. And that includes expectations, right? I mean, I can talk about this a little bit later, but well, let me go ahead and talk about it now. So if we've got these gaps, if you will, so whether we're talking about achievement gaps on state assessments, which they're significant for people with disabilities. We're talking about underrepresentation in higher education or under lack of engagement in the workforce, whatever gap we're talking about. Well, what fuels those gaps? And very often folks will say, well, opportunities. There are opportunity gaps. No question. So when I was at a summit last week and I heard multiple people talk about opportunity gaps. So I completely agree. I just think we have to go further than that. And I think this is hopefully responsive to your question, Nancy. If opportunity gaps feed these other gaps that we're talking about, then my next question is, what feeds the opportunity gap? Because I think unless we answer that question, we're not going to do anything about the other two. And part of what fuels the opportunity gaps, if you will, in my view, are expectations gaps. So if you're talking about employment gaps, achievement gaps, what fuels that? Okay, opportunity gaps, fair enough. But what fuels the opportunity gaps? And in some cases, maybe many cases, it's an expectations gap. So we have to do that hard work at introspection of saying, what do we really expect that people with disabilities are going to go on to higher education? Do I expect that my child is going to live independently? Do I expect that my child is going to be engaged in competitive integrated employment in the community, right? So what are my expectations for people with disabilities as it relates to higher education, as it relates to engagement in the workforce? And if I would say yes to that, right? So yeah, I expect people with disabilities. Do I expect that for all people with disabilities or just some? And I think that's another great example of where Project Search is doing such a great job leading the way in Kentucky, because you're saying, yeah, you got all people with disabilities. The numbers aren't great as you look across disability categories, but we're going to focus in providing these immersive sort of job experiences for an even more significantly underrepresented group. And those are people with intellectual disabilities. So, it is about increasing expectations and creating more opportunities. And none of that happens automatically. Ever. What systems do by default is isolate. Systems by default do not align. Systems by default isolate. So if there's alignment and coordination, and we get hung up on collaboration, but sometimes that doesn't mean all we wish it did. So collaboration, coordination, alignment, we got to go to those places on purpose. We're never just going to sort of end up there.
So I think that, yeah, that's interesting, Johnny, that you say that, because we talk about the systems. I mean, expectations, that's important. But sometimes I think one drives the other as well. I mean, if you don't have the expectations, typically people don't build the systems to meet the expectation. But if the system doesn't meet it, then the expectation is kind of dampered, if you will. And because I think some people may think I don't have the expectation because I don't have a process or a pathway that's clear that I can see for my child or whomever loved one to be able to get from point A to B. So that makes me think a little more in terms of course, I'm a huge fan of Project Search. We have worked to get that launched. A lot of great people on this call. Uh, so I guess when I think of the school system, because that's where we started and that's our feeder, if you will, and the and getting us kids into Project Search. So what could we do, or what have you seen, if anything, on a systemic level, systems level, working with school systems so that we're working with counselors, we're working with instructors, principals, and other people who create the pathway of opportunity so that the expectation can maybe be altered for some people who think there's no pathway.
Yeah, that's right, Dr. Talbert, of course. And one of the things, having been in some of these settings, you know, everybody has good intentions. I mean, I've yet, and I've met with a lot of people in a lot of different places, as we all have. I have yet to meet the first person who wakes up in the morning and says, I'm going to make it as hard as I can on people with disabilities to be successful. I mean, nobody does that, right? But when we get involved in the weeds of our own work and tracking our own scopes of work that we have to report to our own sort of boards or federal partners or whatever, all that's fine and all that's good. I care about program integrity completely. But when we get in the weeds of that, sometimes we just run out of time to be able to do all the other things we know are really necessary to increase this potential. So one of the things that does not happen automatically, and may be responsive to your thoughts, Dr. Talbert, is students with disabilities have all these folks who are writing plans for their success, right? You've got the school system that's required to do an individual education program. That includes, by the way, at 16 or older, every single student in Kentucky, 16 or older, has a measurable post-secondary goal in the area of education and training and employment. Every single Kentucky student, 16 or older. Now, let's say some of those students are also our Office of Voc Rehab consumers. So they've applied for and been determined eligible for vocational rehabilitation services. Well, if that's true, guess what they have? They have an individualized plan for employment. Individualized education program, school, individualized plan for employment. That thing has an employment goal on it. Do we ever talk about how that employment goal in that plan from this agency that wants to help me aligns with or doesn't align the employment goal from this agency and plan of everybody that wants to help me? And then what if the student's involved with Social Security? What if they're involved in Developmental Disabilities Council? You've got 3 or 4 plans that will not automatically talk to each other, right? So that's why innovations, and I mean, y'all can correct me if I'm wrong, but when I think about interventions and innovations like Project Search that are being introduced into an environment that we hope is hospitable to that innovation, I think that's where those sort of third parties and those model kind of demos can help be that outside party, helping people make connections that they're too busy to make, right? That's when I've seen it be successful. And again, nobody's waking up in any of those systems and saying, I'm going to do the best I can not to cooperate and not to align our plans and make it as hard as possible on parents and families to understand how we can help them. Nobody does that. But my experience has been all of those entities and actors need help connecting the dots. And that help almost always comes from the outside, in my view.
Do you, besides Project Search, do you have another program that you think is an ideal example to share?
Well, I mean, we have, for example, we have the Community Work Transition Program, which is a long-standing program at the University of Kentucky. That is sort of early opportunity to develop work skills while you're in high school. So I forgot exactly how many, I'd have to look, Nancy, but 85-ish school districts in Kentucky have a Community Work Transition Program, and they tend to focus on students with more significant support needs. So they're really helping those students have those early opportunities to develop work skills, have work opportunities, working with employers in the region. So this is a joint project that we run here at HDI, and we have since the late 80s, really, I think 87 maybe. This is a joint project, jointly funded by the Kentucky Department of Education and the Office of Voc Rehab. So that's one project, longstanding. A lot of districts, clearly 80-something districts, find it very valuable to them. So that's one thing that immediately comes to mind.
Right,
It's
just
almost
check.
like you need some type of intentionality around it and a checklist or something, because I guess I just think of just the average parent and thinking about any parent, anybody of any, whatever the situation may be, is, if we have these programs, and I know with Fayette County School, like the Academies of Lexington, I'm involved with Bryan Station for the Diversity Health Program. And I don't know how the counselors or the different people in the school system direct kids into these programs, but it almost seems to be, like you said, Johnny, there's no one that's trying to connect all the points, or although no one's trying to make it more challenging, nobody's also not trying to make it
Right.
more easy, maybe, and plant seeds. I mean, sometimes it's also about seed planting to so that people can even engage in that thought process. So it just makes me think, when you talk about this program, the community to work transition program, and then of course now we can talk about Project Search, and but people don't know what they don't know. I always tell people we might have a plethora of programs and great things. But if people don't know about it, because people choose amongst the choices that they're given. And
Yeah.
so when they are not even introduced to some of these options or choices, they don't choose them, because sometimes they don't know what we think they should know, or just because they exist. So I don't know. I would love that, maybe with this partnership and some of these great people in the squares on this call, and just futuristically thinking. And even as we think of Project Search, and we already have the partnership with Fayette County Botech Rehab, Spinks. We have these partnerships. So how do we create like a checklist that says every counselor and instructor, and when you have kids and they're on these IEPs, what have you, I may be saying it wrong. Why are we not thinking about, I mean, somebody, I don't know how you know that. It almost needs to be a repository or something that says, you know, Sally Jones has an IAP for this, and this, and there needs to be a navigator that's saying, okay, let's pull all these people together and have one meeting about Sally, so that we can optimize the options for Sally and her parents or their parents.
Yeah.
Just,
Yeah.
you know.
Absolutely. We've got to have, the way I refer to it is not going to be as eloquent as you just did, but uh, we've got to have processes that outlive personalities. Often when I see this work, it's because some strong, passionate personality took it and said, we're doing this. Now, there's a lot to be celebrated about that. But the other side of that is it ain't sustainable, right? Because that person will not always be there. So we need to have processes that outlive personalities. We need to make these things more automatic, right? And create these to some extent replicable processes and designs and protocols. And I think Project Search, I think there's incredible opportunity here to do that, certainly in Fayette County, but then to do what, not y'all, but the big we, what we don't often do a really good job of, and that is telling other people about our successes and things that didn't work so well, and passing that forward. But anyway, I know we're out of time, but 100% agree. Happy to be a thought partner, resource to you all for anything that you think I can help you with. And I know that I would continue to learn from you, which has really been the majority of this so far.
The time went by very, very quickly. And thank you so much, Johnny. Thank you, Dr. Talbert, and all of your team members for joining us for this monthly session. And we'll see you next month on November 15th for our next training session. So thank you once again, everybody. Thank you. Thank you, Johnny.
Thank you.
All right. Bye-bye.
Great
Bye.
session. Thank you.
Thank you. Yes, it was very good. Thank you.